Hey, friends. Thanks for switching your screens to LX News Now.
You see, cancer is something that affects all of us in one way or another. Just about everyone has been impacted by it, whether through a personal struggle or seeing a friend or relative have to fight it. David and Champ, I'm looking at you guys. And that's why I'm so excited to bring you this promising update, because researchers are finding fewer Americans are dying after being diagnosed with cancer. Take a look at this data. Big picture, overall cancer death rates are dropping in many of the most commonly occurring types of cancer. Focusing a little bit more, the data shows deaths from lung cancer and melanoma declined significantly from 2001 to 2018. But you guys, it's not all good news. The same analysis shows the steady decline in death rates from prostate, colorectal, and female breast cancer has either slowed or in some cases, it's stopped altogether. So as you can see, there's been a lot of progress, but of course, there's still a lot of work that needs to be done. To give us the necessary context we all need, we're going to bring in Dr. Erika Hamilton. She's an oncologist at the Sarah Cannon Research Institute. Dr. Hamilton, thanks for being here. Let's start with the upside. Now, we can throw out percentages and year-to-year declines, all these numbers. We can throw these out all day long, but to make it all easier to understand, in terms of real human lives, is there an estimate on how many lives are being saved?
Yeah, thanks for having me, Eric. So you're absolutely right. For men, the death rates from cancer had declined 2.2% over this 4-year period from 2014 to 2018. And for women, that number was 1.7%. When we factor in that we have about 600,000 Americans dying of cancer each year in the United States, this translates to a benefit of 10,000 less people in America dying of cancer than otherwise would have within a year.
That's so good to hear. So many people. That's fantastic. The declining death rates, though, is all of this because of medical advancements or perhaps changing behaviors, or is it a mix of both?
It's a mix of both. So you mentioned lung cancer and melanoma being our greatest strides over this last period. And that's a great example. Lung cancer, for example, we see decreased smoking rates, which certainly help us from a behavior standpoint. And then we also see improvements in therapies. And in these two particular cancers, that was really twofold. An improvement in immunotherapy, or utilizing the body's own immune system or infection fighting cells to fight cancer cells. And second, a new wave of personalized medicine, or using targeted drugs to something specific in the patient's cancer that can also improve outcomes.
So making strides there on both fronts, but is there an explanation as to why we're seeing promising numbers in some types of cancers, but not in others?
Absolutely. So uterus and pancreas were two cancers where we saw an increased rate of death. And then, as you mentioned, there were a couple other cancers, breast and colon cancer, for example, where we saw the rate of decline slow down or even grind to a halt. And these are obesity-related cancers. So we now know that over 40% of Americans are significantly overweight. We cannot entirely prevent these cancers, but we can decrease them through things like maintaining a normal body mass index or weight, exercise, or decreasing alcohol consumption.
So, we have a lot of people watching this right now. It's sure to give them a lot of hope, especially people who are scared and suffering with their own diagnosis right now. What's your message to them?
I think that this is really encouraging progress in decreasing deaths from cancer. We saw a decrease in 11 out of the 19 most common cancers in men and 14 out of the 20 most common in women. And so the parting message I would want to leave is make sure to stay up to date with your doctor's visits and your cancer screenings. We're starting to see a little uptick in more advanced cancers presenting due to reluctance to go to the doctor or do cancer screenings from COVID. And so we really don't want to see any of this progress erode and want to keep this moving in a forward direction.
I'm glad you mentioned that, because with things being closed off and people being isolated in their homes, can you talk briefly about the importance of, now that things start to reopen, getting checked out, getting your regular checkup, making sure you're taken care of?
Absolutely. We've been at this with COVID-19 for a while, and so your health systems are well equipped to keep you safe going to a cancer screening or going to a doctor's office. For example, in a mammogram, you can wear a mask the entire time. Don't even need to take that off. And you may have also seen some updated recommendations around colon cancer screening. We've seen an increase in cancers in younger patients. And so we've actually changed the recommendation for colonoscopies from 50 years of age down to 45 years of age.
All right, Dr. Erika Hamilton of the Sarah Cannon Research Institute, thank you so much for putting that great news into context.
Thank you.